let's talk about sodium nitroprusside. Sodium nitroprusside is a powerful, rapid-acting vasodilator medication that is used in lowering the blood pressure, particularly in hypertensive emergency and during a surgery to reduce the bleeding. And let's talk about how it works to reduce the BP. Usually, sodium nitroprusside works by releasing the nitric oxide, which causes relaxation of vascular smooth muscles and cause dilation of both veins and arteries that result in decrease in preload and decrease in afterload. As you know about the sodium nitroprusside, it is a powerful arteriodilator and vasodilator, but it is such an unstable compound that it rapidly decomposes on exposure to light. So, the solutions will be freshly prepared and the infusion bottle and entire drip set should be covered with a black paper. Let's talk about the dose of sodium nitroprusside. We usually start from the 0.3 max per kg per minute, and the maximum dose that we can give is 10 max per kg per minute. The most important key point regarding sodium nitroprusside is that after initiating sodium nitroprusside infusion, we can expect a rapid decrease in blood pressure. So we should have a keen observation after initiating this drug, as sometimes sudden drop in blood pressure can cause a stroke. So we need to taper and titrate the medication as per the response of the medication. Now let's talk about the adverse drug reactions of sodium nitroprusside. The most important side effect of sodium nitroprusside is severe hypotension that can lead to reflex tachycardia and palpitation. So we need to have a close monitoring of blood pressure. And another side effect is cyanide toxicity due to the prolonged administration of sodium nitroprusside, which can cause anorexia, nausea, vomiting, fatigue, and disorientation. And at the end, let's have a short discussion on hypertensive crisis. If the systolic blood pressure is above 180 mm of Hg and diastolic blood pressure is above 120 mm of Hg, then it is considered as a hypertensive crisis. And if there is an end organ damage present, then it is called a hypertensive emergency. But if there is no involvement of end organ damage, then it is called a hypertensive urgency.